Right, welcome back. This is Morning Cafe. TV47 Health continues, and from matters colon cancer, we dive and change the whole conversation to something else, really, about drug abuse in the country, particularly now into an emerging trend in the country, but then we'll be getting to know how emerging really is it and how common is it. In the European countries, in the North Americas, it is quite common. In the Asian countries, it is quite common. I'm talking about synthetic drugs. So first off, with the help of our infographics, we'll be trying to understand what synthetic drugs really are. So according to the it says a synthetic drug is a drug manufactured artificially by humans and really using chemicals. So we'll be trying to understand what this is. Even before we continue with these other infographics, just to help us understand hii maneno yote ni nini, we do have a senior programs officer from the National Campaign Against Drug Abuse, Triza Mwangi. Very good morning to you.
Morning to you as well.
Thank you very much for making time to tuongelele this conversation, the synthetic drugs. So we do have that explanation of what a synthetic drug is. I know you can help us understand even better what, in layman's term, what a synthetic drug is really.
Okay, thank you. Synthetic drugs, basically psychoactive substances that are manufactured in the laboratory, so not necessarily natural growing substances, but substances that have been specifically, manufactured to bring that psychoactive effect when someone consumes them. Yes.
Right. We're also being told that it can be smoked, snorted, or injected, but a considerable share is tableted.
Yes.
That is according to United Nations Drug and Crimes.
Yes. Synthetic drugs come in various forms, like you have rightly put it, and the most common synthetic type of drugs are those we call amphetamine type stimulants. So most of the time you'll find them either in a tablet form or in crystal form or sometimes even in liquid form. So basically this is to try and attract the market, and that is why, for example, when it comes to tablets, you find them in very colorful, tablets, so that they may attract the market. However, amphetamine type stimulants or synthetic drugs, as we put them in general, are an emerging global challenge for the world and even for Africa. Even though these are not very common, drugs in Africa, however, they are slowly penetrating into the market. A while ago, Kenya and many African countries just used to be conduits for such drugs. But now you find that we are slowly becoming consumers of these new psychoactive substances. And basically it's because the world has become a global village, and what is happening in Europe, in a minute, it spills over to us through, technology. So that is one of the challenges that, technology poses to us in Africa and in Kenya, because all the new trends that we are experiencing now have actually come from other areas, and therefore, through social media, through technology, those trends are spilling over to us like almost immediately.
So that is what has now shifted the dynamics of, because you say we used to be a conduit. So
yes,
that means that these drugs would get into our borders and then transported elsewhere.
Yes.
But then not much of usage would be there. But then right now, a number of people are using these particular drugs. So the fact that now we do have a number of people using it, what is, even as of Nakada, the proliferation of borders, particularly even in the coastal region and other borders, what is Nakada doing to end this?
As an authority, we have come up with a national strategy for addressing issues to do with alcohol and drug use in this country. And this strategy touches on prevention of substance use. The strategy also touches on treatment of those affected, and it also touches on law enforcement, because law enforcement is a key component when it comes to prevention of matters alcohol and drugs, because with the proliferation of these drugs into our market, you find that that not only affects the health of the Kenyans, but it also is a security concern. And therefore, there are also efforts to try and ensure that there are regular, surveillance along our borders, just to try and make sure that we do not have these drugs getting into our market. However, much as the government is trying on matters surveillance and enforcement, you still have got some, drugs still spilling into our market. And that does not speak to failure by the government to ensure that the security and safety of the Kenyans are, guaranteed. But however, it is the dynamism that comes with issues of alcohol and drugs in matters of entry, control and prevention. However, we have seen an improvement in terms of surveillance of our borders, because we keep getting reports from the media about seizures of, consignments being caught every day along our borders. One of the most notorious points is the Mandera border, where we have cannabis from Ethiopia, coming into our country most of the time. But the law enforcement team is really doing a good job, because most of the time those who are, in the trade are caught, and the consignments are also confiscated.
But then someone would ask, this compared to natural drugs like cannabis that would be getting in from these borders, Mandera, from the coastal region, Mombasa, and others. Now comparing to synthetic drugs, which is made in the lab, someone might have this stock and produce them locally in Kenya. So my question would be, first of all, do you have reports of locally made synthetic drugs in Kenya? Because Ali told us that we are conduit, so that means these drugs are getting from other places and coming into the country. Do we have locally produced synthetic drugs?
I would say we do not have information as at now about locally manufactured synthetic drugs. Remember, this is we call them new psychoactive drugs in our country. And most of the time, by the time those drugs get to us, they are usually from other countries. Okay. So as at now, we do not have intelligence of whether there are any Kenyans manufacturing synthetic drugs in our country. But maybe to quote one case, though that was on heroin, a long time ago, I think a few years ago, there is a farmer who had been contracted to grow the poppy opium plant. Unknowingly, he had, the contract had very good terms, and therefore he went ahead and planted the poppy opium plant unknowingly, without knowing that actually he was engaged in planting a crop that would later, produce heroin. So that was caught the eyes of the enforcement teams before it got to the manufacturing level. Yes. So
at this point, no reports really of this. You'd mentioned that the use of it in Kenya isn't as high. Why do you think that is the case? Is it the fact that maneno ya bei, ama what's really the issue?
It's not about the pricing or the cost of the substances. It's only that this is an emerging trend. And being an emerging trend, it doesn't come and hit like, in big time. So it spills over small. Like we have these synthetic drugs in South Africa. In Nigeria, we do have. But the fact that we have some little spillage, because one of our studies say about 0.3% of our population had reported, having used psychoactive substances. So what we are saying as an authority, we recognize that, yes, we could be having some new psychoactive substances in form of synthetic drugs in our country. However, the trend isn't yet alarming, and that is why we are trying to create awareness so that we try to prevent, those who haven't, gotten into this synthetic drug use from getting into the use.
And even probably lowering that number.
Of course, yes, because when you look at the effects of synthetic drugs, compared to probably to other drugs, you start using amphetamines like today, and 6 months down the line, you completely look different. The effects are so adverse and so radical that it affects, health and life in general within a very short time. And that is why it is important to educate Kenyans that as we talk about these other drugs, alcohol, cannabis, heroin, and the rest, that we also try to educate Kenyans on the issues surrounding synthetic drugs. Because sometimes they pose as, people have become very creative, that they would less sometimes candies with synthetic drugs. And then the children would consume that and probably start behaving, funnily. So it is important that we educate that nowadays, even some other, confectionaries, talk of cookies, talk of cakes. Nowadays, sometimes there are those who lace them with cannabis, and especially meant for the young population. So that is also an emerging trend that is equally dangerous.
Still on the whole effects, so this means that the addiction rate for a synthetic drug would be way higher than for natural drug.
Very true, because remember, these are chemicals, mixed up in the in the laboratory to form that which is referred to as a synthetic drug, and therefore, when consumed, within a very short time, you get addicted to the drug, and therefore the effects. Sometimes people could even suffer, multiple organ failure out of the use of synthetic drugs, because remember, you do not even know the combination, you do not even know the dosage, and therefore issues of even overdose come in, and you find people dying out of overdose, or the adverse effects that these synthetic drugs may have on especially the vital internal organs.
Right. Earlier you had mentioned about the amphetamine, and I'd like us to continue just looking at this infographics. So we're taking a look at what it really means. Let's take a look at even some of these types of synthetic drug stimulants as well. And so there is the amphetamine, as you had rightfully said. Also do have, so what's the difference? We do have as well the methamphetamine. Is it part of an amphetamine? What is the methamphetamine?
Methamphetamine is one of the categories under what we refer to as amphetamine type stimulants.
Okay.
So we have methamphetamines, we have amphetamines. So all are new psychoactive substances that are also referred to as synthetic drugs. So the only difference is the name and probably the combination of the chemicals and the presentation. But most of the time you'll find that the presentation is the same.
Right.
Yes.
Still, according to the United Nations, do you also have fentanyl?
Yes, there is also fentanyl, although I know there were videos that went around a while ago, viral on social media about the cost, insinuating that there were Kenyans who had become, hooked to fentanyl. However, we did a fact-finding study, and there was no fentanyl in our market. There wasn't.
Right.
Yes.
Right. The UN also tells us that there's MDMA, which is commonly referred to as ecstasy.
Ecstasy, yes. Ecstasy is also one of the forms of a synthetic drug, even though still not very readily available in our market. However, these are drugs that, like I put it in the beginning, are slowly spilling into the African market, so to put it so. And therefore, when something spills into Africa, like in our previous study in 2022, about 0.3% of Kenyans said they had, used, synthetic drugs. So it's not to say that we do not have them completely in our country, but it's only that the percentage of or availability of those drugs in our market is a bit minimal.
Right. Let's take a look at, so these are the types. Let's get into the numbers and really see how common is it. So again, globally, we start with globally before we get into regionally. So they say 62 million of this are the number of people who use opioids and basically the whole synthetic drugs. This is still according to the United Nations. Is this really disturbing for you?
Yes, it is, because like I put it, like in 2022, the same World Drug Report estimates about 27 million people having used methamphetamine. It is a worrying trend, because what is happening elsewhere will slowly get to us, and it's already here with us. It's only that the numbers are minimal. And looking at the new trends that are in our market, like nowadays, young people do not smoke, you know, the cigarettes. There are other forms of tobacco that they are using that are equally dangerous. And when you look at the tobacco market, when, for example, they are marketing what is also referred to as novel tobacco products, these are vapes or electronic, you know, type of, you know, the cigarettes. It is a dangerous trend.
And because the fact that you mentioned now for the vapes, right now you'd find even on social media, they are readily sold. They're sold. So are they legal in the country or illegal?
Initially, you know, those are tobacco products. And as you know very well, tobacco is a legal substance in our country. However, due to the risk that tobacco poses on the health of Kenyans, then the reason why we educate on the effects of, you know, tobacco, and when you look at the pack, the cigarette pack nowadays, you will find that there are infographics put in there to try and deter Kenyans from smoking. However, we still have got Kenyans smoking, and that has evolved now to, you know, the e-cigarette, because there is a perception that the e-cigarette is safer compared to, you know, the other cigarette. However, that is not true, because we know that tobacco has got quite a number of carcinogenic substances, and therefore when used in any form, whether as an e-cigarette, whether as this you know, conventional cigarette, it still poses the same risk as anyone using any other form of tobacco.
So the fact that it's flavored doesn't even help the case?
Doesn't even help the case. In fact, sometimes it becomes worse, because with flavoring also comes in other chemicals, and therefore that also introduces, you know, other substances into the tobacco that also poses a great risk to Kenyans. So
that means that someone can legally, because they say tobacco is legal in the country, that means that someone can legally sell the e-cigarettes and the vapes rightfully. Is that right?
Yes, because it's a legal substance. However, the challenge we are having is with online marketing. Because when you go to purchase, you know, a vape pen, for example, or through social media, do the seller get to verify whether you are over the age of 18? I don't think so. So that is how now these vape pens are getting into you know, the hands of children, because it's becoming more common and fashionable with high schoolers, and therefore that becomes a risk, because we, as educationists, you know, we know that when you initiate drug use early in life, then that poses a great risk with regards to getting addicted very fast, with regards to your brain development, and therefore that becomes a risk when people start using substances early in life.
Right. Just like for the cigarettes, when you buy that packet, because Nakada tells us that you're not allowed to buy a single stick. You're supposed to buy the whole box of it. And the box, as you rightfully say, has the warning, the caution that it will have, it may cause health effects in your body if used kutumika sana. For these e-cigarettes, first of all, are they locally, are there some that are locally manufactured in the country? And if not, if we're going to be, if it's imported, does Nakada push for warning labels on these e-cigarettes?
Most of these products, again, are imported, not locally made. and therefore we also have got a board that is responsible for tobacco control in our country, the Tobacco Control Board, established under the Tobacco Control Act. And therefore, through the board, because we work in partnership with the board, then we are able to push in some of these policy issues that we think will be beneficial to Kenyans. Like, you know very well that nowadays you are not supposed to advertise tobacco products, but then on the contrary, that is happening in the online, you know, in the digital market. And therefore, that is something, an emerging trend that also needs to be dealt with at policy level, so that we also try to limit, you know, advertising in the digital platforms, because now that is where most of the young people and sometimes those who are underage also get to access some of these substances. Yeah.
Right, just finally still on the whole infographics, so that is globally. Let's take a look at in Kenya now as well, and just seeing how the numbers are relatively, as you're telling us, about, should be, is it 0.6%
Yes.
of those who are using, if you can have that infographic for us, who use methamphetamine as well. That is as far as it goes, yes. So in 2022, an estimated 27 million people used this particular drug worldwide, and also have, so between the age of 15 to 16. So we're seeing a whole trend of even underuse as well. You had mentioned about it briefly, where someone might be selling to someone who's 18 years and below. So that means that even as Nakada, you're foreseeing a situation where in the coming years, as much as right now it is not common, but then it's an emerging trend, as you put it. So that means that in the coming years, we might be seeing people under the age of 18, just like the natural tobacco, getting hooked to some of these synthetic drugs.
And it's already, you know, as we see young people, you know, some of them already hooked to alcohol and these other substances, this is also likely to happen. Why? Because synthetic drugs are also illegal drugs in our country. And you know, most of the time, these illegal drugs are sold in the black market. And of course, in the black market, there is no control, and therefore anyone can be able to access those drugs. And therefore, we foresee a trend, and that is why we are starting this conversation early enough, because we cannot ignore the 0.6% of Kenyans who have, you know, confessed to having used, you know, methamphetamines. And therefore, that is why we come in to educate, so that we try to prevent those who have not yet, you know, started using these substances, to kind of not deter them from using. And for those who have already started using, also inform them that there are also treatment options available. It doesn't mean that getting, you know, addicted to substances is the end of life. There are treatment options available, and you can still bounce back to your feet even when you think you're already in the trench.
Hapo kwa treatment options. Normally, when you talk about drug abuse, rehabilitation centers say that we are ready. We have the staff, we have the personnel and equipments ready for people who are addicted to certain drugs. Naturally, for the natural drugs, really. But then now for synthetic drugs, it is an emerging trend. As Nakada, looking over an overview of rehabilitation centers, either publicly owned or privately owned, as rehabilitation centers and even the personnel participating in this addiction recovery process, are they equipped with the know-how of rehabilitating someone hooked into synthetic drugs?
I must say that as an authority, we are committed to building the capacity of addiction practitioners in this country. And what you may not be aware is that we run courses that end up certifying those professionals as international, you know, professionals. So there is a course that we run that is internationally accredited, where we get to educate, and at the end of this program, program, they have to sit for an exam, and therefore they get the accreditation. So our addiction practitioners are well equipped, though not all. So this is a continuous process that we are continually carrying out, just to see to it that our addiction professionals in this country get to a level where they are able to handle any type of emerging, challenge when it comes to treatment and rehabilitation. So yes, our addiction professionals are well equipped, even though not all. So this is a continuous process. So when they finish the program, we have two programs actually. We have the universal prevention curriculum, and then we have the universal treatment curriculum. So the treatment curriculum is what we run through the addiction professionals in, and they have to sit for an exam at the end of the program. When they qualify, then they get certified as internationally accredited, addiction professionals. Yes, so in terms of emerging trends, because this is also, a global curriculum, so it means that it takes care of all emerging trends. Yes.
And even as you continue watching us, you have realized that the social media handles running through pale chini 22047 namba yetu ya SMS 0793267279 ni ya WhatsApp 0795045864 is the number to call us. And even as you call us, send in your feedback about synthetic drugs. Drugs basically manufactured in the lab. You might have come across them or seen them on social media. Na unataka kujua hii ni nini? We have a program officer from NACADA just helping us understand all this. And the fact that you sit on the helm of programs and planning programs countrywide in the country, still on the whole bit of rehabilitation centers, because I remember Deputy President Rigathi Gachagua saying that they're going to, as a government, make sure that we have a rehabilitation center at least in every county. First of all, how is that going? That progress of at least having a rehabilitation center in every county. And secondly, so we're going to have these rehab centers equipped, because as you say, the courses for the personnel to also have the know-how of these synthetic drugs. So at least a center in every county, so that we don't have knee-jerk reactions, let's say in the next coming 10 years, because in the next 10 years, these numbers might change again due to the digital media. So what are we doing so that we don't have knee-jerk reactions in the next years?
Thank you. With regard to treatment and rehabilitation facilities, I would say that we still do not have enough facilities. Most of the centers in our country are actually private facilities. However, we have a few centers that are run by the government, and one being a model center that is run by the authority down in Miritini. And as an authority, we made efforts to also try and support counties to establish, rehabilitation facilities. And so far, we have, supported 10 counties to establish treatment and rehabilitation facilities. However, not all the centers are again completed. So this is an ongoing process. And in the long run, we envision to have, like you rightly put it, to have a rehabilitation facility in every county. And this is how we envision that coming. We have the County Alcoholics Drinks Control Acts, which were modeled from the Alcoholics Drinks Control Act of 2010, which is the national law. And in this law, counties are supposed to set aside part of the fees that they collect from licensing to go towards rehabilitation of those that are affected by substances. And therefore, we are lobbying with counties to ensure that that fund is properly utilized, because what is happening in most counties is that that fund is treated as revenue, and therefore when the counties collect from licensing fees and all that, then they use it in their recurrent budgets. However, there is that the law is clear on I think a certain percentage that is supposed to be set aside to carry out prevention activities, treatment and rehabilitation, and therefore we are working with counties to ensure that that fund is set aside for the purpose that was intended by the law originally. So in the long run, yes, I oversee us having a treatment center in every county.
But then to assist this, the local community law enforcers, how much information do they have about synthetic drugs? Because right now, the information that they'd have, even from the authority, is tackle illicit brew, cannabis, and other natural drugs that are quite prevalent in the country. But how much information do they have about synthetic drugs?
I must say that education is a continuous process.
Okay.
And therefore, they might not have, you know, all the information that pertains to synthetic drugs. However, this being a continuous process, you see, as the issues emerge, then as an authority, we get back to programming and see what we can do.
Okay.
First of all, to educate the masses, to educate the law enforcers, because those are our key partners when it comes to running the campaign. And therefore, we normally would have sessions with law enforcers, you know, regular sessions, just to try to bring them up to speed with whatever is happening in the global market, so that as they do their surveillance, they are also aware that apart from just dealing with illicit brews, we also have got these other emerging trends in terms of synthetic drugs. Yes.
So does that mean that, because for a law enforcer to enforce a law, that would mean that there has to be an existing law that they're enforcing? Currently, for the lawmakers, do you now think that they should again amend some of the laws that are there when it comes to drug abuse in the country that can also reflect on the fight against synthetic drugs?
Yes, and this is currently ongoing.
Okay.
We have the Narcotics, Drugs and Psychotropic Substances Act of 1994 that is currently under review, just to take care of these emerging trends. So therefore, as we deal with the education side of the campaign, law enforcement, we also review laws. And one of the laws that was seen to have been overtaken by time and events was the Narcotics, Drugs and Psychotropic Substances Act of 1994. So it is currently under review, and it takes care of issues of even the fines that you are supposed to be fined when you are caught, for example, with a consignment of cannabis or any other psychoactive you know, substance. So this is an act that had been overtaken by time and events, and therefore that is why it is currently under review. And once it is reviewed and passed, then it means that also education follows, especially to the law enforcement on the provision of the law.
So it has been tabled to the National Assembly?
Yes.
Okay, so we wait for it to be passed.
Yes, yes.
And see how it's going to be. Back to the whole bit of the local community, because, okay, actually still on that, because now this law enforcers have known that these are the laws that should be there. These are the amended laws when it comes to the fight against synthetic drug and the fight against it. But then now for the local community, what should they know this morning about the synthetic drugs? Because we'd really say this are synthetic drugs, but then now the main concern would be nikitaka kupigana na hii synthetic drugs pamoja na nyinyi na kada at the grassroots level, hii synthetic drug inakaa aje? How does it resemble na hizo vitu zote?
Most of the time, our local communities know of what is locally available in their community. And as an authority, we are also building the capacity of civil society organizations within communities, just to try and ensure that they are in you know, a position to assist, like you're saying, in the fight or in the campaign against alcohol and drug use. And therefore, when you go into a certain community and just try to find out what is available in that market, most of the time they will tell you what is available. And if there is anything new that has come into that community, then they are able to highlight and say, we have this kind of tablets that we see our young people taking, and when they take these tablets, this is what happens.
Right. Briefly, allow me to interrupt you there. We'll get back to the whole local community a bit, but then let's pick this call. Yeah, John kutoka Makueni. John, habari asubuhi. Asante sana kwa kutupigia. Watu wa Makueni mnaendeleaje? Uko na swali au feedback on this question, on this conversation?
Makueni tuko poa, niko na swali. And a concern at the same time.
Yes, endelea.
Okay. Kwanza niulize, I would love to know the kama side ya NACADA in relation to street children.
Okay.
When wanatumia drugs, especially at very young age.
Right.
Then what is the plan of NACADA? Do they have plan to work with the Ngao, the local community, on how to eradicate such? And then this is now the concern.
Right.
There was a time I met NACADA officials in Makueni. I'm a health promotion officer.
Okay.
I tried to ask them whether there is a way NACADA can work with the health promotion officers. I'm not talking about health promoters. Train the health promotion officers to have behavior changes first.
Right.
On how to disseminate the information they are giving to up to the lowest level in the community.
Okay.
So as to realize their dream. Is there a possibility of working with this Department of Health Promotion? Because it was created by the government, but it is doing less.
Right.
Though it is a very, very much important department. Can they strike a deal to work with such departments
Right.
at the county level, community level, up to the lowest level, so as to realize their dreams and even help the street children? Thank you.
All right. Thank you very much, John. I think your question umeirusha to at the right moment, because we're talking about grassroots and this whole education getting into deeply, but you're jolting down his questions, the very pertinent ones,
Yes.
bringing about a whole different dynamics of this.
Yes.
First of all, tuanze kwanza na street children using some of these drugs, either the synthetic drugs or the natural drugs that they'd find around them. As NACADA, where are we on this?
With regard to street families, let's call them families because not all are children.
Yes.
We work with partners to try and educate, street families, as well as work with partners like Undugu Society, who have actually elaborate programs from identifying these street families to empowering them economically, to even reintegrating them back to the families. And through Undugu Society and other, partners, we are able to work together and come in to provide the education that is required to these street families so that they also get to a level of understanding of how these drugs, for example, affect their health and lives in general. So we, as an authority, we do not have a special program for them, but we work through partners to ensure that they also get the care and the education that they require. In matters to do with health promotion officers, this we regard as a very key partner in the campaign against alcohol and drugs. And therefore, in this financial year, we will be working with health promotion officers. First of all is to build their capacity, because they do a very commendable job in terms of even visiting, communities and just getting to highlight the issues affecting certain communities. And therefore, first of all, we are going to build their capacity through what we are going to establish as community work groups. So, rightly, like you put it, we are now moving away from, the national outlook and now going to the communities where now you find establishments. And in this regard, we are also promoting what we are calling community, rehabilitation initiatives. So apart from training, we are training them on matters advocacy. We are also training them on matters of basic rehabilitation, so that by the time this health promotion officer goes to a community and finds someone, for example, in a state of confusion, probably this is someone who is maybe withdrawing from alcohol, for example, they are able to know that this is what needs to be done and probably rush this person to hospital so that they get care, they get the medical care that they require. So this is a very key partner to us, and we are incorporating them into our programs because we know that they are the ones who are uko mashinani kabisa, and therefore they are able to reach out to everybody. The other thing that he raised is about our
so still on the whole, the community health promoters, these officers getting in and loading in with the government, having quite a number of them. Government launched this health promoters, and right now they're working there. But what kind of signs and symptoms should they be keen on for persons using synthetic drugs? Because naturally we'd know for alcohol, utaona huyu amelewa because of maybe the stench, the staggering, for example. For synthetic drugs, because it's a new trend, it's an emerging trend, as you say. What kind of signs and symptoms does someone portray when they've used them?
For community health promoters, I think that is part of what we shall be doing in the training. However, for now, since they are already in the community and they are working, they should be able to look out for signs of confusion. For example, if they find someone who is not smelling alcohol, for example, but this person is confused and dizzy and staggering, sometimes that could be as an effect of the use of synthetic drugs. Again, one thing that is common with the users of synthetic drugs is that they also neglect personal hygiene. So it could be someone who is working somewhere, is known to be a very neat person, but then in terms of hygiene, that is forgotten. Because remember, when you get addicted to most of these substances, what revolves around in your mind is about how to get the substance, use it, and the cycle continues. And therefore, what they also need to check for is about issues of conflicts even in the family, because most of the time when people start using these amphetamine type stimulants, for example, you know, they are also not very cheap. So you find that conflicts arise in the home because they are unable to, for example, provide for their families, and therefore end up in conflicts. The other thing about synthetic drugs is that, remember, they are illegal substances in our country, and that is something important that I would like the health promoters to also be talking about, because when something is illegal, then it means that when you're caught with it, you actually can go through the judicial system and probably even end up in jail. However, we are also educating on rather than, you know, taking someone through the court system, can they be assisted to seek for rehabilitation, you know? Because right now we have quite a number of Kenyans who are on harm reduction programs. For example, what we call the methadone program, where...
Is nicotine, the nicotine patch part of that as well?
Nicotine patch is also one of the treatments that assists those who are addicted to nicotine. However, it is a therapy that works, but not, it also has got some of its dynamic, because remember, it is a replacement therapy, and therefore it ought not to be used for too long, because it might end up again causing addiction. You know, you can cross addiction from one drug to the other. In terms of county level, he also talked about our presence in the counties. And I would gladly report that now we have 19 county offices, including Makueni, where John comes from. We have an office established in March this year, and therefore he could visit the office and also get to interact with the officers there and just get to see how best they can, you know, also utilize them from now that local community. So yes, we have 19 county offices. I may not be able to mention all of them here, but we have that list on our website. People can check to see whether their counties are represented, and this is a continuous process, so slowly by slowly we will get to all the counties.
Right. So before John called, John from Makueni, you're explaining to us what these synthetic drugs might look like for someone who is watching right now and they're wondering, inakaaje? Because as you say again, they're illegal. But then again, we're having that whole conversation of vapes as well. So vapes would be legal, but then for synthetic, so debunk for us this. What synthetic drugs look like. And the difference between the synthetic drugs as well as even other kind of drugs.
Okay, thank you. Synthetic drugs mainly come in form of tablets and sometimes crystals. So I know most of the Kenyans know what is called like the eucalyptus crystals, something like that. So they will come in form of either clear crystals or colored crystals, and sometimes tablets that come in various forms, colorful, you know, tablets, pink, orange, blue, all forms of colors. And when maybe just to this is important for Kenyans. When someone tries to introduce something new to you in form of a tablet or sometimes also less in candies, you know, that might be a drug that they are introducing to you that could actually make you go the drain in a period like of 6 months. So synthetic drugs will come in form of tablets, crystals, or sometimes even liquid, so depending on the kind of synthetic drug that it is. One of the synthetic drugs that I think forgot to discuss was tramadol, which was, I don't know whether it is still in the market now, a prescription drug.
Okay.
An opioid-based painkiller that is very powerful, very addictive, but is able to address pain. And therefore, when it was realized that it also was becoming an addictive substance, because now even for those who are not unwell, realize that by using this substance, then this is what may result, or this is what you might actually be able to feel, then it became a dangerous drug. And you have already seen in the West that we are also having a problem with the opioid-based painkillers. You know, you find that most of the people now, there is actually a crisis with regard to opioid-based painkillers. Yes.
All right. Let's talk about the challenges that you have encountered so far. The kind of research you've done over the years, mapping out different counties in the country. First of all, which counties have maybe a higher prevalence rate than others? Even for those coming to seek help, what kind of challenges are they experiencing?
The challenges are many. However, it is through challenges that we also get to grow and also get to think out of the box as an authority. In terms of these other drugs, let's say alcohol, cannabis, heart, you know, for a very long time, people thought that, you know, Central Kenya is most affected when it comes to alcohol. However, the study that we did in 2022 communicated a different picture.
The Western region.
Now it is Western region.
Yeah.
And probably it's because in Central it was very well highlighted and therefore interventions were already put in place. But that not to say that the problem is, you know, finished in Central Province. Okay. In Central Kenya, we still have got a problem. Even though now, you see now other counties are emerging, you know, in terms of consumption. And therefore, when it comes to, again, the challenges, the issue surrounding alcohol and drug use is actually a behavior change, you know, issue. And therefore, as we educate, as we carry out our campaign, the sole decision whether to use or not to use substances lies with the individuals. You see, as you educate, you tell them this is what is likely to happen when you use synthetic drugs, for example, but you still find some people still going on, you know, to use and just to get to experiment with these drugs. Okay. And you know, sometimes just by experimenting, that is how people get hooked. Yeah. For some drugs, you don't even you don't have to use them many times. It's 2-3 times and you are looking for them yourselves. Yeah. And therefore, when it comes to challenges, again, emerging trends. Like now we are talking of something called butt charging or use of alcohol, you know, through the rectum. A very dangerous practice that our young people are now adopting. Yeah. And you see, by virtue of how dangerous the, you know, the act is, we are also trying to, in fact, we did a statement the other day just to caution the public about how dangerous that act is. Because first of all, you introduce large volumes of alcohol to your system, and you see the rate of absorption is also very high, so that could lead to alcohol poisoning within no time. And therefore, that being a very dangerous trend. So as much as we are doing all that we are supposed to be doing, issues keep on emerging. And we need, as an authority, to keep coming up with ways to try and mitigate this. and educate the Kenyans, for example, on the issues. When it comes to vaping and the e-cigarettes, again, that has been a very common trend with young people, and including the use of shisha. And Kenyans know very well that shisha is a banned substance in our country, but I think that which is banned is what Kenyans go for, you know, and it is very popular with the ladies as well. And the fact that it is flavored tobacco, and why the government through the Tobacco Control Board came to ban the use of shisha is because initially it was flavored tobacco. But in the process of using, it was also discovered that it was also being laced with other hard drugs, heroin, for example, cocaine, for example, and therefore people were not using flavored tobacco as it was purported to be, but they ended up using a combination or a concoction of other substances as well, so posing a great risk to public health.
Right. And before we wrap it up, because I see we have about 7 minutes or so, kabla tumalize, and I love the fact that you have highlighted some of this quote-unquote community accepted kind of drugs, the vapes as well, the butt chugging, some of these methods. There's also now Mira and Ilabusa, which for years, I mean, these ones that we were mentioning are emerging ones. These ones have been there for years on end. And there's still that push and pull of the ban on Mira in some parts. We did see the coastal region as well. For the Busa, and some of this brews, locally made kind of brews, even in the western region, the leader saying, apana msianze kutupiga vita because this is part of our culture, really. According to Nakada, how should the health promoter approach some of this? Because at approach a community, be apana busasi mzuri. The leaders will again say, no, this is part of our culture. That also goes for Mira as well.
You know, when we talk of use of substances being part of our culture, then we need to go back to years back and just try to learn how then was alcohol used. For example, Muratina in our community. Long time ago, it wasn't supposed to be served in large quantities. It was just for that occasion that existed. And there were categories of people that were not allowed to drink. But nowadays what is happening is that that which we are calling our culture, children also get exposed. And in fact, the Kenya Bureau of Standards has developed a standard for manufacture of changa. However, nobody has bought that standard. Because you could actually manufacture, pack, and sell your changa, even in a supermarket, if you buy the standard and implement what the standard, you know, says. So that is where we are going wrong, because it doesn't, the law does not abolish our traditional drinks, but what it does is to categorize. You see, like how, and I'm sure you have also highlighted as media people how these drinks are usually made. You will find that all types of adulterants are added to those kind of drinks, and therefore that becomes a dangerous drink. In fact, you have heard many people call it poison, because once people start using, because it's part of the adulterants that are added to those what we call illicit brews is something like formalin. Formalin is the drug that preserves dead bodies. So when it is added to a drink, then what does that mean? They're killing you slowly, or preserving you while alive. And therefore that becomes a very dangerous, you know, trend. And therefore, if someone went and bought the changa standard at Kenya Bureau of Standards, they will be allowed under hygienic conditions to manufacture and sell changa that it has a sticker from Kenya Bureau of Standards.
So when you buy it, do you have to, the frequency of renewing this standard, does that happen?
I'm not very sure of that, but I know a standard is something that stipulates how something should be made. And therefore, if you went against, for example, those standards, then it means you are not doing as per the standard.
So if someone is interested, they can reach out to NACADA and
Kenya Bureau of Standards are the owners of the standards. They are the ones who entirely do that, and therefore they can buy the standard there, establish a company, and start manufacturing their own liquor. But the problem we are having is how this what we are calling traditional brews or liquor is manufactured under very unhygienic conditions. And before we finish, very important is that there are Kenyans who could be wondering what to do, especially when they find themselves in a situation where they are addicted to substances or they need help. And therefore, as an authority, we have a toll-free hotline number. The number is 1192, and Kenyans can call any time of the day or night and access services in terms of counseling services and also referral to other, treatment and rehabilitation facilities. We also run a model center down in Mombasa. So therefore, we are also in the business of ensuring that we have that model center where these other rehabilitation centers can come to learn best practices and therefore are able to improve standards in terms of treatment and rehabilitation. So very important that people also get to know that through that number you can be linked to other services as well.
Right. I love the fact that you mentioned that efforts are underway on all this, specifically on matters synthetic drugs. But then just to wrap it up, in a nutshell of what we've discussed, as a takeaway home for someone who's listening to us in a minute, what should they know?
Okay, thank you. What Kenyans should know is that we have synthetic drugs in our market today. And apart from synthetic drugs, we also have these other drugs that have existed with us for quite a long time. And what we are saying is that there are efforts to ensure that we educate the Kenyans about the effects of the synthetic drugs and also try to prevent use of drugs. And I think as we mentioned about the use of drugs among children, I also forgot to mention that we also have got a guideline that we are also implementing with the Ministry of Education in schools to try and deal with matters, alcohol and drugs control around schools. Remember, for example, the kiosks around schools are the ones that usually are the source of drugs, and therefore that is also going on to ensure that we also keep our children safe from drug use, because the earlier we initiate drug use, the more problems we will have in future.
Asante sana. I hope you've learned a thing or two or 100 about our conversation today about synthetic drugs and overly about drug abuse in Kenya. NACADA says that it is an emerging trend, not quite a lot of research on synthetic drugs in the country, but then this means that in the next coming years, this might be one of the biggest problems in the country. So what do we do to avoid the knee-jerk reactions in the coming years? If you've missed this conversation, check out our YouTube page as well, TV47 Kenya. Follow us on our social media platforms. Asante sana for being with us from 6